Hi everybody, it's Melanie and I'm checking in with you with week 21 post-op. I had the traditional duodenal switch surgery on March 30th, 2016 in Knoxville, Tennessee with Dr. Rob Williams of New Life Bariatrics, and the surgery was at Tenova Medical Center, Turkey Creek, Knoxville, Tennessee. I am not going to do a weigh-in with you guys today. I'll save that for next week, and I'll tell you the reason behind that. I have been battling a urinary infection. This is week 2 of it, and I'm on my second round of antibiotics, and those are wreaking a little bit of havoc with my system, and I'm having to stop my supplements until I can get this infection knocked out, and the vitamin and the medicines that I'm having to take with it. So I'll get into that more because it actually is kind of related to the weight loss and lots of other things that we as patients can go through. Excuse me. So I will get back to that in a minute. One thing I did want to share with you, if you remember from a few videos back, on August 1st, I had labs drawn at my 4-month visit with my nutritionist. I did get the labs back. I have had those back for a little bit, but I had to meet with my primary care doctor 2 days ago on Monday to discuss some of those results. So I'll be talking about that to you. So I've got a spreadsheet here with some of my lab results, so please pardon me if I look off to the side. Some of the things that I'm not going to share absolutely everything with you because I had a ton of labs drawn, but there are some things that I wanted to share with you that are kind of exciting that maybe you can expect as a weight loss surgery patient. One thing in particular was my blood glucose, my blood sugar. Last year, as a matter of fact, at the end of June 2015, my blood glucose got as high as 147. And at 4 months post-op, my blood glucose was 76. That is really, really good. My lipid panel, which is like your fats and cholesterols and things like that. Let's see, a year ago, my total cholesterol was 215, which is very, very bad. And as of August 1st, it was 144, which is ideal. As a matter of fact, it is under the radar for any kind of risk of heart disease or anything. So that is a beautiful number. My triglycerides last year, they were 165. This year, 105, right on the money. My HDL cholesterol is down to 46. My LDLs, which is the bad stuff, they were 130 last year, and now they're down to 77. So as far as sugar and fats, we're looking great. We're looking really, really good. My doctor said he wishes his levels were that good. So yeah. As far as vitamins, everything's looking really good on those. No standouts. Everything was right on the money on those. Iron, calcium, A, D, E, K, all of those. Magnesium, phosphorus, everything's looking fantastic. So the vitamins are going to stay as is. We're looking really, really good on those. My thyroid stimulating hormone was high, and that's not good. The thyroid stimulating hormone goes up as a signal to your body to say, hey, we're not getting enough thyroid, something's up, and it shows that your thyroid isn't producing enough. So that was one of the things that I had to discuss with my doctor on Monday. So I'm now taking thyroid medication. The reason they didn't see it, they think that they didn't see it elevated in the past, is that possibly all the other things that were going in my body might have been masking that. But they said as far as body symptoms that I had been showing, and my doctor had been suspecting it for a while, and we're doing further testing to see if maybe I have Hashimoto's disease. But right now we're starting with a low dose of thyroxine for treatment of the thyroid, and we'll see how it goes from there. So it's okay. It's definitely treatable and definitely something we can deal with. My B12 was off the chart. The upper limit for B12 is supposed to be 963, and mine was over 2,000. That's not bad. You can't go toxic from B12. I had been taking a B12 sublingual every day, and I've backed that off. I'm going to be taking B12 once a week now, and we'll see how it goes. If my energy level drops too much, I may push it back up, maybe every other day, but they said nothing to worry about. They were just like, what are you doing? You can't go toxic from it, so no worries. My zinc was a little high. Top level limit for zinc is supposed to be 860, and I was at 870. So they said, don't worry too much about it, but if you start to feel lightheaded or dizzy, let us know. So I was taking 2 zinc supplements a day, and so I'm backing that off to 1 a day, and we'll see how it goes from there. But I mean, it was only 10 points above, and which is not really huge because the range is from 440 to 860, and mine was 870, so just a little bit over. They said not enough to really, have a fit about. So, but everything else, guys, was phenomenal. Looking great, feeling great, except for the urinary tract infection. So 2 weeks ago, I was having trouble going to the bathroom, and I noticed blood. And I had, in my insurance, we have an after-hours doctor that we can call, and he can actually call in prescriptions for us. And I called him and told him what was going on, and he prescribed an antibiotic over the phone. So I went to my pharmacy, and I took it all last week, and I ran out on Saturday. Well, Monday morning, bingo, here it goes. I'm having trouble going again, and there's blood. So I just happened to have an appointment with my doctor on Monday, and I mentioned it. I'm having this trouble, and so they prescribed a different, more powerful antibiotic, and it's more powerful, and I can't take calcium along with it, and I can't even eat foods with calcium. So my whole diet game plan is off. I've stopped my supplements for this week while I'm taking this new antibiotic. Just everything is off until I get this infection kicked. And so one of the things that I had to do at the doctor's office Monday was I had to do a urine test. And I got the results from that last night. And there was protein in it. A little bit, and a little bit of the ketones would be expected with a low-carb diet, but not this high. So the doctor says we're going to look at it again in 3 months when we reevaluate you for your thyroid as well. So, of course, you know me. If I see something off, I'm going to study. So that's the first thing I did. I started hitting the medical journals. And I discovered something that our kind bariatric surgeons aren't telling us. Guys, if you are a Roux-en-Y or a DS patient, there is a very real possibility that you are at risk for kidney stones and kidney problems. Who knew? I mean, I actually have a history of kidney stones, and because of that, when I hear risk of kidney stones, my ears perk up, because I do not want to go through that again. Guys, passing a kidney stone hurt worse than having a baby, and I've had 2 babies, all right? That is no lie. I know it hurts, and kidney stones hurt way, way, way worse. Way worse. I would never want to go through that again. And if there's something that's putting me at risk for that, I'm going to listen, and I'm going to do everything I can to avoid it. So there have been some medical studies done, and one of these came from the Oxford Journal of Medicine, the other came from the National Institute of Health, and they both referenced about 30 other studies that actually focused on Roux-en-Y and traditional duodenal switch patients post-op and their risk of kidney stones, because they saw a lot of patients come back and present with either actual stones or kidney problems, And when they examined the kidneys, even biopsy, they found the presence of oxalate crystals, which is what makes kidney stones. So they started saying, okay, what's the deal here? It comes down to two things. One, fluid intake. You know, when we go see our doctors and our nutritionists, they talk about what's your water, water, 64 ounces, water. And we hear this all the time. It's constantly preached at us, water. But they never tell us why. They never say why we got to drink all this blessed water, do they? Mine never told me. Mine just said drink it. Well, here's why. It's to flush your kidneys. It's to flush the toxins out, to flush the mess out. And the 64 ounces, that's a minimum. According to the studies that I've been reading, as far as the kidney problems, they're saying you got to go for 3 quarts, and that's 96 ounces for it to be therapeutic. Now, I know I'm not hitting 96 ounces. I have a hard enough time getting to 64, but I am now, they have my attention. Children, I am sitting up and listening, okay? From now on, if I don't have a cup in my hand, it better be within reach, because I'm not playing around when it comes to kidney stones, okay? I'm not playing around. So, water, it's not just to keep you hydrated, it's to keep your kidneys flushed. You got to take care of your kidneys. I mean, I have seen people go through dialysis, and it is not pretty. I've seen people go into kidney failure. It is definitely not pretty. The liver, you know, we have the fatty liver problem. Liver can heal itself. Kidneys can't. When you've damaged your kidneys, they're damaged. So, take care of your kidneys. I'm not kidding on this. Get your liquid in. 96 ounces. That's what we got to shoot for, guys. 96 ounces. Okay, besides the fluids, the other thing that can be done to combat the kidney stones and the oxalate crystals in the kidney is calcium, but not just any calcium. It's got to be calcium citrate. The calcium binds with the oxalate to make it soluble. So instead of it forming little crystals in your kidneys and combining into stones, the oxalate becomes soluble and it goes through the body instead of sitting there, okay? And that's done with calcium. Now, it's got to be calcium citrate, because the citrate part of the calcium citrate, the citrate actually inhibits the crystal formation and growth, and it raises the urine pH. So, calcium carbonate does not do that. Calcium carbonate, or carbonate, however you want to say it, doesn't have anything to do with the oxalate crystal formation. Only calcium citrate does that. So you've got to look at what kind of calcium it is you're taking. And all of these studies said minimum calcium intake needs to be 1,000 milligrams, and that's 1,000 milligrams elemental calcium from calcium citrate. If you are a Roux-en-Y or a duodenal switch patient, if you are a bariatric surgery patient that has any kind of intestinal reroute, so that means Roux-en-Y, it means traditional DS, and it means loop, SIP, SADI, whatever you want to call it. If you had one of those 3 where you had your intestines played with, you need to be taking a minimum of 1,000 milligrams elemental calcium from calcium citrate. Calcium citrate, I can name 2 over-the-counters you can get that from. You can get it from Citracal, or a generic of Citracal. You can also get it from UpCal-D. UpCal-D powder, the powder that I take, that's calcium citrate. If you are taking PatchMD calcium, that is calcium carbonate, and it will not work for this purpose. That calcium gets into your blood, and it's fine for your bones and teeth and all that sort of thing, but it doesn't do squat to prohibit or inhibit the oxalate calcium formation of the crystals in your kidneys. That has to be calcium citrate. So if you are taking PatchMD calcium, which is calcium carbonate, you are not taking the correct calcium to prevent the kidney stones. Okay? So you're going to need to look at something else. PatchMD calcium is only calcium carbonate. You're going to need calcium citrate. So look very carefully at whatever kind of calcium you're taking. Now I know like I think Celebrate has some calcium chews, and I believe those are calcium citrate. Look at your milligrams. It's got to be a minimum of 1,000 milligrams that you're taking. So to recap, water, it actually is important. And if you're a Roux-en-Y or a DSer, we need to be shooting for 96 ounces. And it's to flush the kidneys. And look at your calcium. You've got to take your calcium. Yes, it's for strong bones and healthy teeth, but it's also for your kidney health, because that's how it gets the oxalate stuff through your body. Because it's not good to accumulate, because it makes those stones, and we don't want the stones. And if not just the stones, the crystals. You can have the crystals without them actually forming into stones, and the crystals in your kidneys will also prohibit your kidneys from filtering out like they need to. And if your kidneys aren't filtering out, then they go into failure. And when they go into failure, it means you go on dialysis. And eventually you could go on the waiting list for a kidney transplant. You do not want your kidneys to shut down. Like I said, your liver can be hurting, and your liver will repair itself, but your kidneys, once they're damaged, they're damaged. You do not want to have problems with your kidneys. And any of you who are diabetic or who have been diabetic and have had kidney problems, you know exactly what I'm talking about. It is not something to mess with. So I'm telling you, if the one thing that's standing between me and kidney failure is 96 ounces of water and 1,000 milligrams of calcium citrate a day, I'm going to take it. And I'm not going to argue. And every bit of this that I'm telling you is coming from medical journals, like the Oxford Journal, like the National Institutes of Health. And it also comes from the Association for Metabolic and Bariatric Surgeries, the AMBS, whatever it is. Y'all know what I'm talking about. Anyway, guys, that's our learning for today. Pencils down. I love all of you. I hope everybody has a great week, and we'll see you next time, where I will check in with weight, hopefully once I get this infection kicked. Love all of you, and sparkle on.